Hello everyone. Our chapter today is about solubilization techniques using the new drug delivery system. We will start with a revision to remember what is solubility, how to calculate, how to classify it. First, the drug could be described as very soluble if 1 gram drug dissolve in smaller than or less than 1 milli solvent, and freely soluble if 1 gram drug dissolve in 10 milli solvent, 1 to 10 milli solvent, and so on till we reach the insoluble active ingredient when 1 gram drug need more than 10,000 milliliter. It means more than 10 liter to dissolve. In this case, we can describe this active ingredient to be insoluble. There are so many techniques to increase drug solubility. Many of them are very simple and some of them are a little advanced. For example, complexation with cyclodextrin, as we studied before, complexation with any other ingredient to make a soluble complex. So something like a reaction between the active ingredient and certain excipient or polymer to increase the drug solubility by forming a complex. We can use solubilizing agent like surfactant. We can change the solvent. If the drug is insoluble in water, we can use any other solvent like acetone, chloroform. We can make mix of solvents like adding a co-solvent. We can add 5%, 10% ethanol to water to have a mixed solvent. In this case, ethanol could be a co-solvent. We can also reduce the particle size of the drug to be in the micro range or to be in the nano range, which is more effective to increase, of course, solubility, because nano is smaller, and by reducing the size, the surface area of contact between the particle and water will increase, and so solubility will increase. There is something also called solid dispersion, where we are mixing the active ingredient with another powder, but this powder is highly soluble, so the drug become dispersed in another solid, and this other solid is highly soluble. We will take that in more details now. And also we took solid dispersion in one of the previous courses. We can change the pH of the solvent if the drug is weakly acidic. If the drug is weakly acidic, we can increase the pH, so the pH will be alkaline. So acidic drug in alkaline medium, it will dissolve. If the drug is weakly basic, we can reduce the pH, make the medium acidic. So weakly basic drug dissolve in acidic medium because of formation of salt. We can also chemically modify the drug. We can add polar group like OH, NH2, or we can convert the drug to salt or soluble ester. By this technique, we can increase its solubility also. The first technique, we'll talk in little details about it as a revision also, is complexation. We have an example from the market, which is iodine. Iodine solubility in water is 1 gram in 3000 milliliter. It means 1 gram can dissolve only in 3000 milliliter water or more. So it gives a percentage solubility milligram percent of 0.03% aqueous solution, not more than that. We cannot prepare 0.5 or 1% or anything more than 0.03%. But they found that if we add sodium iodide or potassium iodide, it will react with iodine and form a polyiodide complex. That's why we have in the market, or according to USP also, the iodine topical solution is 2%. Which is too much higher than 0.03% due to presence of 2.4% sodium iodide. So when we mix sodium iodide with iodine, we can increase the solubility and we can prepare a solution of iodine 2 gram in 100 milliliter. And so here also it is 0.03 gram in 100 milliliter, not 0.03 milligram. Another technique is adding a surfactant, and you know that each surfactant is having polar head. This polar head could be OH group, COH group, any polar group, and non-polar tail, and this non-polar tail could be CH2, 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 and CH3, and so on. So that is a surfactant molecule, and this molecule After adding to water, it will remain on the surface. The polar head will be facing the water, if that is the water, and this is air. So like dissolve like, the polar head will face water and the non-polar tail will be outside water, will be facing the air, because relatively air is more hydrophobic than water. So when you add more and more surfactant, the surface become very saturated. So any extra surfactant you add, it will aggregate in water and form micelle. The concentration at which this surfactant form a micelle is called the critical micelle concentration, or CMC. The active ingredient, if the active ingredient is lipophilic, it will escape and hide inside the micelle and dissolve in it, because the micelle itself is having very small size, and the active ingredient will disappear inside the micelle, and the micelle will disappear inside the lipophilic core, because here in the core there is the lipophilic tails also. So like again dissolve like. When you add more surfactant, more micelles will be formed, and the solubilizing power of the surfactant will be higher. So if we increase the surfactant concentration, solubilization also will be more. So adding a surfactant here is very effective solubilization technique. As we said here, when surfactant is added at low concentration, it will tend to orient to the air-liquid interface between water and air. When you add more surfactant, the interface becomes occupied and saturated, and any excess molecules will become aggregated inside the medium, inside the water, the bulk of water itself, and it will form a micelle only at the critical micelle concentration. And solubilization is depending, of course, on the concentration of surfactant. So by increasing the amount of surfactant and by increasing the concentration above the CMC, solubilization will increase. So the ability of surfactant to dissolve a drug start only when a surfactant form, and then by increasing the concentration more, solubility or solubilization will be higher. Griffin in 1947 developed a sample scale from 1 to 20, but now it extends beyond 20 also. This scale gave a number to each surfactant. Each surfactant get a number like span 20 get 8.6, span 120 get 4.7, and tween 80 get 15. This number indicate the hydrophilicity and lipophilicity. If the number is higher, close to 20, it means the surfactant is very hydrophilic. And if the surfactant is hydrophilic, it likes water, so it will make oil in water emulsion. It will prefer making oil in water emulsion. If the number is closer to 1 or 2 or 3, it means that the surfactant is lipophilic. And again, if the surfactant is lipophilic, it will make water in oil emulsion. So again, if we talk in another way, if you want to make oil in water emulsion, we have to use which surfactant? We have to use tween 80, for example, or tween 20, because they have relatively higher HLB, they are more hydrophilic, they tend more to form oil in water emulsion. If you want to make water in oil emulsion, it's better to use span 85, span 120, span 83, because this surfactant are having low HLB and tends to form water in oil emulsion. Another technique to increase solubility in this fast revision on the previous courses is co-solvency. Co-solvency, of course, is very simple. If the drug is insoluble in water, you can add another solvent like methanol, ethanol, and acetone. And this solvent should be able to dissolve the drug and should be miscible with the original solvent, otherwise an emulsion will be formed. So solvent used to increase the solubility are known as co-solvent, of course. This co-solvent should be, of course, non-toxic, non-irritant, should be miscible with water, otherwise will form an emulsion, and by default it should be able to solubilize the active ingredient. Technique number 4 is solid dispersion. And in solid dispersion, we are mixing the active ingredient, which is soluble, with another excipient. And we had that before in a previous course, like polyvinyl pyrrolidone. We have to mix them by certain techniques. There are many techniques to prepare solid dispersion, and by mixing them well, the active ingredient will become dispersed on the surface and inside the polymer, the soluble polymer. So these points are active ingredient, and the whole bulk is BVB. So we have like microparticle or something like, or particles formed of BVB. Inside BVB and on the surface of BVB, the active ingredient is dispersed. Both are solid, that's why it's called solid dispersion. You are dispersing solid or mixing solid with solid. One of the successful technique to prepare the solid dispersion is solvent co-precipitation. Solvent method or co-precipitation method, these methods depend on dissolving both active ingredient and excipient in a common solvent. For example, if the active ingredient and BVB dissolve in ethanol, so take both of them and dissolve them in ethanol. After dissolving both of them, just evaporate ethanol under vacuum or whatever. After evaporation, what will happen? Both of them will precipitate. So precipitation will happen. Precipitation of both together, active ingredient and BVB or the excipient. When both of them precipitate together, they will form a particle. Common particle has both of them. So that's why it is called co-precipitation, because both the drug and the excipient precipitate together. But the drug, when it precipitates like that, it will become amorphous. And you know that amorphous active ingredient or amorphous powder is more soluble than crystalline powder. We have an example here. If we have our active ingredients, antifungal griseovolvin, you can imagine that that is the solubility of griseovolvin itself without micronization. When we reduce the size to be in the micro range, the solubility is higher. And when we mix it with BVB, polyvinyl pyrrolidone, as solid dispersion in a ratio 1:5, 1 drug and 5 BVB, solubility is higher. When we increase BVB to 10, it becomes higher. When we increase it to 20, it becomes higher and higher. So you can imagine that even solid dispersion is more effective in solubilizing the active ingredient than micronization or reducing the drug particle size. Then we can also change pH, as we know also that the drug could be non-ionized, and in this case changing pH is not useful, as the drug could be ionized. Usually it is weakly ionized. We don't have strong ionized active ingredient. HCl and the NOH are not drugs. So most of drugs are weakly ionized, either weak acid or weak base. If the drug is weakly acidic, we can increase the pH, make the medium alkaline. The opposite medium will form a salt. The weak acid will form a salt. Like salicylic acid, it forms sodium salicylate at higher pH. While if we have a weak base in acidic medium, it will form a salt also in acidic medium, like atropine in sulfuric acid. Atropine is basic in sulfuric acid, it will form atropine sulfate and increase its solubility. We can also make a chemical modification of the active ingredient by converting the drug to a soluble ester or salt, so it will be more ionized salt, or addition of polar groups like OH, like ketone, aldehyde, carboxylate, sulfonate, nitrite, amine. So all these groups will increase the drug solubility and dissolution rate as well. Another slide for revision to remember what is the biopharmaceutics classification system or BCS. If you remember that all active ingredients could be classified into 4 classes. Class 1 is having high solubility and high permeability, so they are classified based on solubility in water and in different media and permeability throughout the GIT membrane. So class 1 is having high and high. Class 2 is having problem in solubility, solubility only is low. Class 3 drugs are having problem in permeability. Class 4 are having problem both solubility and permeability. So as a researcher, if you want to solve the problem of class 2 drugs, so we need to make solubilization. But if the drug is class 3, we have to add something to increase permeability of the drug throughout the GIT membrane. Class 4, it needs both to increase solubility and to increase permeability. One of the relatively new drug delivery system is nano suspension, and from the name, the nano suspension, of course, is submicron. The size should be less than 1 micrometer, so it should be in the nano range, and it is nanoparticle of the drug itself without much excipient. There is no much polymer or something to sustain the release, or because of course we are making the nano suspension here to increase the solubility. So it is not nanoparticles. Nanoparticles usually contain drug and polymer. And this polymer could be lipid, could be something huge polymer, but here we have nano suspension of the drug itself to increase, of course, solubility and dissolution rate. The only surfactant, the only excipient we add is just surfactant to increase or to facilitate size reduction, because in presence of surfactant, if the drug is precipitating, in presence of surfactant, it will precipitate in very small size because of reducing the surface tension. And after precipitation, presence of surfactant also will stabilize the nanoparticle, will prevent aggregation and caking by several techniques. Nano suspension can be used by different routes of administration, including topical, transdermal, of course, per oral or oral, pulmonary, ophthalmic, because it is small in size and non-irritant, parenteral, especially intravenous, because it is in the nano size and it will not block any capillaries. For preparation, we have mainly two techniques. One of them is called bottom-up technology, or called also precipitation technique, and the other one is called top-down technology or disintegration technique. Let's take them one by one. The first one is bottom-up technology or precipitation technique, very similar to solid dispersion. You are dissolving the drug in a solvent, but here the solvent, for example, is acetone. It should be also miscible with water. So the drug is here, dissolved in acetone, and it should dissolve, of course, not suspended. And here you have water, and this water has much surface active agent to facilitate reducing the size, as we said, and to stabilize the formed nanoparticle. And stirring should be very high, not less than 1000 rounds per minute, mixing or stirring. And then you will add the drug dissolved in acetone. You will add this beaker number 1 to number 2. So by adding the drug to the water containing surfactant, salting out will happen. The drug will precipitate, but this precipitation will lead to formation of nanoparticle because of two factors, mainly the presence of high concentration of surfactant and the presence of strong stirring at 1000 RPM or more. As you can see, it is very simple process, low cost, ease of scale up. You don't need specific equipment. You can use high speed mixer, and this could be on large scale without any problem. But the disadvantage is the drug should be soluble in the organic solvent and insoluble in water. And the organic solvent and water should be miscible together. Otherwise, when you add the solvent to water, it will not form nano suspension, it will form emulsion. If you use chloroform or methylene chloride, when you add it to water, it will form an emulsion and the drug will not precipitate as nano suspension. So the drug should be soluble in one solvent and insoluble in the other, and the two solvents should be miscible together. The second technique to prepare nano suspension is top-down technology or disintegration technique. In this technique, you are mixing first the drug with the surfactant as a powder and disperse it in water. And after dispersing it in water, it will form, of course, coarse suspension, normal suspension, not nano suspension. And then you will push this suspension to pass through a grinder called high pressure homogenizer. High pressure homogenizer will convert this suspension into a nano suspension. If you remember also that the high pressure homogenizer, here there is a pump that push your suspension at very high speed to pass through very small space. The idea is simple, just the suspension is passing in very small space between this valve and this cold valve seat and impact ring. So passing through this very small space will reduce the size. And usually we are using different cycle or several cycles. You are taking the homogenized product, maybe first time it will become micro, and then take it again and again and again. You may need several homogenization cycle. It means rotation or recycling of the product and pushing it again to pass again and again. So this is very efficient and effective in reducing the size now into 40 to 500 nanometer. There is also the ball mill. The ball mill, there is ball mill on large scale and there is a ball mill on a small scale that can make nanoparticle. And if you remember, the ball mill, it has metal balls in a cylinder rotating at certain speed. So these balls are taken up and down. When it goes down, it will impact and hit the powder and grind it down to form nanoparticles or nano suspension. So again, you will make a mixture between the drug and surfactant and adding it to the ball mill. So by rotation, it will grind it into a nano suspension. The other dosage form, relatively novel also, is self-emulsifying drug delivery system, or SEDDS. Self-emulsifying drug delivery system. And even we have two types in research now and in the market as well. We have self-micro-emulsifying drug delivery system and self-nano-emulsifying drug delivery system. So this system could be micro, could form a micro emulsion, and could form a nano emulsion based on the amount of surfactant. And from the name, what is the meaning of self-emulsifying? It means that this dosage form will make an emulsion inside the body without any interference. So we are not preparing an emulsion. You know that the emulsion is oil, water, and surfactant. This is the normal emulsion. This one is formed of oil, surfactant, and something helping formation of emulsion called co-solvent or co-surfactant. You can use one of them or both of them without adding water. So let's talk in more details. You know that the oral route is the most convenient route for any patient, better than injection, better even than topical gels. So the problem is 40% of active ingredient are insoluble in water. So the bioavailability is very low. Self-emulsifying drug delivery system is very common and used for increasing the drug solubility after oral administration. So it is something specific for oral administration because it needs water, as we said, to form an emulsion. Again, the system has no water. It is formed of oil, surfactant, co-solvent or co-surfactant, something to help the system to form an emulsion without stirring, because the emulsion will be formed inside the body, and something will make it also as a micro emulsion or nano emulsion. So after oral administration, the above components are mixed with the GIT component with the gastric fluid and form an emulsion inside our body. So it is relatively more stable than any other emulsion because it will not segregate on the shelf life. It will remain as an oily solution, if you can call it an oily solution. It is oil, surfactant, and co-surfactant, and the drug, of course. Inside the body, it will form an emulsion in situ and immediately. Here, the preparation is very simple, and that is an extra advantage also, because you are mixing the drug in a vial with oil, surfactant, and co-surfactant, and then you are making vortex or sonication or whatever for 30 minutes. You are heating the system up to temperature 40, but we have to make sure that the active ingredient is stable at temperature 40. And then that's all. The system now is prepared. Everything is clear and dissolved. So then you can store it at room temperature, even it is stable at room temperature, no need for refrigeration until further use. And the further use here is administration by patients. Of course, the main aim of self-emulsifying drug delivery system is to increase the drug solubility because of formation of microemulsion or nanoemulsion inside the body with high surface area, high solubility. Also, the presence of surfactant and co-surfactant inside this system will increase permeability, because you know from previous courses that surfactant could disrupt the lipid present in the GIT membrane, increase the paracellular spaces, and increase absorption. So many surfactants also could inhibit B-glycoprotein, permeability glycoprotein, or BGP, and this BGP is mainly for efflux, for taking the drug back to the GIT, for protecting our body from toxic material. So by inhibiting efflux, by inhibiting taking the drug back to the GIT away from blood, by inhibiting this mechanism, the drug will be absorbed more and more. We can also add a positively charged component in the self-emulsifying drug delivery system. If our self-emulsifying drug delivery system is positively charged, it will tend to interact with the cell membrane and form a vesicle and make endocytosis. So it will tend to take the active ingredient inside any cell, which increase cellular uptake, increase internalization. So if our drug is acting internally inside the cells, like most anti-cancer drugs, it will be very useful to make it in a positively charged self-emulsifying drug delivery system. Another mechanism or another novel dosage form to increase the drug solubility is micelles. And you know again that micelles are formed of surfactant, which is formed of polar head and non-polar tail. At CMC it will form a micelle, and if the drug is insoluble it will be hidden inside the core here, in between this non-polar tail or hydrophobic tail. The problem of these micelles, which are formed of a single surfactant, single type of surfactant, it has low drug loading, it cannot carry much drug, it has relatively large particle size and low stability. So after that they created something called mixed micelle, and it's something very simple also. Instead of using single type of surfactant, we can use 2 or 3 types of surfactant, which by using this many types of surfactant, we can increase the drug as a micelle stability, the drug loading and encapsulation. Because for example, if the drug need HLB12 and we don't have HLB12, we have a surfactant which HLB4, very lipophilic, and a surfactant with HLB20. We can mix them together by certain ratio, by different ratio, to offer this HLB, which is ideal for drug solubilization and encapsulation. This is why if we use mixed micelle, or if we use more than type of surfactant, we can control the HLB to be more suitable and best fitting the drug need. The most common surfactant used in micelle nowadays are polyuronics, and polyuronics are not a single compound. There are a series of polymers called polyuronics, series of surfactant. They differ from each other based on the ratio of polyethylene oxide and polypropylene oxide present in each of them. Polyethylene oxide is polar and hydrophilic. So the polymer or polyuronic contain more polyethylene oxide will be more hydrophilic, while polypropylene oxide is more lipophilic or non-polar. So the polyuronic contain more polypropylene oxide, more PPO, will be more lipophilic, and it will form water in oil emulsion. So as you can see here from the graph, based on the amount of hydrophile, which is polyethylene oxide, and the amount of hydrophobe, which is polypropylene oxide, polyuronic could be polar, could be semi-polar, could be totally non-polar or lipophilic. It could be also liquid or based or solid. So each point or each symbol or abbreviation here is giving an example of polyuronic. There are more than 20 or 30 type of polyuronic, and the letter L, it means liquid, B based, F stands for a solid. A polyonic usually form a spherical micelle, and it's formed by self-assembly. It doesn't need much stirring or energy to form the micelle like an emulsion. It will form very easily, and it has very small size, less than 100 nanometer, which is good to escape from capturing opsonization and phagocytosis by the reticuloendothelial system. So it is something good to escape from immunity, of course. And usually also polyonic is non-irritant, not too much like some other surfactant, having low cytotoxicity when you give it topically or even by injection, although it is non-biodegradable. So it's very strange to be non-biodegradable and safe, but it is non-biodegradable, but at the same time it has very low molecular weight, less than 5 kilodalton, so it can be filtered and cleared by the kidney. So it is not essentially to be non-biodegradable, but it is not accumulating inside the body. It will be excreted easily by the kidney within few hours, so it will not have negative side effects. Thank you so much.